I'm going to raise the issue of healthcare reform.
Yeah, sure.
Every candidate has a plan.
Not everyone does. That's the problem. They
okay.
should.
Well, I want you to summarize your plan and tell us
Yeah.
why it is that we should pay more attention to your plan than anyone else's, and also maybe talk about how it is that over the course of nearly 3 decades of service as an elected official, you don't have a significant healthcare reform accomplishment on your resume beyond extending healthcare coverage for children.
Well, I would disagree with that. Having spent 7 years to 3 presidents and 2 vetoes to write the Family Medical Leave Act, has been 50 million Americans have taken advantage of it. Has been a major asset in terms of health care. As any good pediatrician will tell you, the presence of a family member in the recovery of a child is profound. And so I would, with all due respect, challenge the assumption that they haven't made a contribution when it comes to people's health issues. And there are. I've focused on children. That's true. So all the stuff on premature births, infant screening, pharmaceuticals being tested for children was not an insignificant achievement to accomplish, since we produced 121 products in 7 years, and only 7 existed before. So and now we're doing medical devices as well. So these are, again, these are pieces. I would argue that things like writing the first child care development block grant with Orrin Hatch back, providing affordable, quality, available child care, at least for many more Americans than existed in the past, was important from a health perspective as well. And there are a lot of issues that don't necessarily put an insurance policy on your plate, but designed to improve the quality of health in the country.
But excuse me, but before you get to the rest of it, children, we all love kids, they're cute. But can we only afford to give health care to children?
No,
Can't we?
no, I'll get to this in a minute.
The rest of it always seems to be focused on children, and then we just give up.
Well, part of the argument was, and I don't disagree, when the debate occurred earlier back in whether or not to have a comprehensive health care plan. I, in fact, was going to start doing something for children, and people said, don't do that because you'll end up just doing things for children. And then people turned around and actually did something for children because it was a way to start. So, I don't disagree. Well, let me tell you what we've advocated. But let me, at the end of it, I want to tell you what's missing in all of this, in a sense. We've advocated, and again, you can go to the website and read all of the details if you're, too much of the weeds in this, but make the major points to you here. It's a completely universal plan. We insist upon everyone paying in, and everyone will benefit, but you have to do this. This is not like automobile insurance where you mandate it and don't have a way of actually making sure that everybody's included. So whether through your filing your tax returns, even when you pay no taxes but file, or W-2 or W-4, or show up at a provider, you're drawn into this. So we achieve universality by insisting upon it through a variety of places where you may access the system. So in 4 years, we believe we can have virtually unanimous participation in this at that vehicle. Secondly, this is a completely portable plan. It follows you, not your job. So no matter where you live in the country, it will track you. Thirdly, we ban discrimination against any pre-existing conditions at all in the plan. Fourthly, the structure I use for it is the Federal Employees Health Benefit Plan, which I and millions of others have, including your local postmaster in every hamlet in the country. So it's a national structure that already serves very well a rather large constituency and has been very effective. Within that plan, I have options. My health care plan is very different today than it was 10 years ago when I was single. Today, with 2 young children and a wife, I have different needs than I did then. And as an American, I want choices to be able to make about what sort of coverage I want, where I am in my age, where I am in terms of responsibilities and the like. And I think people like choices in the country in that regard here. The government part of this is to establish what we call a universal health mart, in a sense, where people would pay into that. Insurance industries, companies that want to offer policies, could be a part of that. They can offer their policies within that framework here. And then based on employers' decision to either keep their own plans or to draw down on the plans that exist in there, and that within the universal health mart, people could make choices. We're confident the prices will come down on this for the following reasons. One, it's not a regional plan, it's a national plan. So the bargaining unit is the country, in a sense. We're going to be in a much better position for these people who want to have our business to be able to have to bargain effectively in order to lower their prices and be competitive. Secondly, you spread out risk, not based on a community or a company, but across the country. So it isn't just the elderly and sick and poor, it's the wealthy, healthy, and young as well included in that model. So you end up bringing down those prices considerably, in my view. Thirdly, I believe in the notion of rewarding those who keep us out of a hospital and away from a surgeon's knife as much as we do those who perform the surgeries. We don't do that enough. And sort of really promoting prevention by changing or at least altering the incentives enough so you can bring down those costs. And then going beyond, and I talk about this, but the idea that I think it's 49% of school districts in this country have exclusive contracts with soft drink companies and junk food companies because they don't have enough resources to pay for the band or the drama department or whatever else, and then we wonder why there's an obesity problem and why there's an even out diabetes problem. So the prevention areas go beyond just the strict plan itself, but things we need to do. Medicare administrative costs are 5% to run that program. The general cost of operating a health care plan as it exists today is 34% out of every dollar. If you reduce that just to 27%, you save $150 billion a year. In 27, there's no great success, but clearly moving in that direction is going to be essential. And I think obviously the information technology and valuable tools available today, we can do a lot of that, so you can bring those costs down. This is an attainable plan. We're not electing a king or a queen in November. We elect a president. I presume the country will be fairly divided still politically, within the House and the Senate and so forth. No one party is going to write all of this, any more than any one party wrote the things that I've written on child care and family leave and all the other things I've talked about. I partnered mostly with conservative Republicans in every one of those issues, intentionally, because it wasn't going to happen if I didn't. Not because I wanted to, but otherwise it would just be a series of speeches and nothing would have happened. And that's going to have to happen here as well. So we've tried to accept ideas that work, that are in place today, without inventing something altogether new here, and sort of moving away from the impediments that have allowed this to keep costs reasonable, move down, and have the universal effect of reaching all Americans here. We spent a lot of time in developing this. It wasn't drawn up in a week or so, talking to people. And it's been regarded as a very good plan because it does have the elements in there that I think can attract people who would otherwise take a single-payer idea and just reject it out of hand. And most Americans don't want to scrap everything on the table, which is what you'd have to do in a single payer. Every negotiated health plan and every labor union contract would go, everything else. You'd have to start completely fresh. It would take years, and the costs are staggering to do it. So there's nothing static about this. This ought to be organic in the sense that this, I think, gets us to the point where you get universality, you get a national proposal, you get one that really does at least control, if not bring down costs here, deals with chronic illnesses, the prevention elements. And that's the last part here that's maybe what's been missing. I say this respectfully, and I haven't challenged it in one of these silly debates we're going through. But every time I hear my colleague from New York talk about how many scars she has from the failure in 1993, I find myself sort of bracing a little bit. Because politicians talking about their scars are hardly comparable to the scars that people have paid because it was mismanaged. And it was terribly mismanaged. And I was there and a supporter of their efforts. But it was totally mismanaged. And we cannot do that again. So having people who know how to do this, have been through enough battles, knows how to bring people together. I'm not suggesting everything I've mentioned here will be endorsed or supported by everyone. But I think it's enough of an attainable framework that I can attract people who would otherwise be resistant to talking about a universal plan with active involvement by the federal government to manage a part of this through the universal health care idea, as well as bringing in those elements today that have to be a part of this if we're going to retain cost to some degree.
You mentioned these scars. She got those scars in 1993. They've had plenty of time to heal because they didn't do anything since then. Have you, I don't want to crib from George Will, but can you get angry enough to drive this thing home and really devote your energy to it? Because Harry and Louise will be after you and everybody else.
Well, I think the difference here now is one of the missing, the piece of the equation that's moved is business. The cost of a single GM automobile, every car has a $1,500 health care cost per automobile.
Yeah.
A Toyota has a $150 health care cost. And just the economics of this are causing business. We had the first strike at Sikorsky Helicopter in 45 years. They have a wonderful relationship, management-labor. In fact, management offered a pretty substantial pay increase to the employees down there. But they reduced substantially the health care coverage that UTC was going to play to the Sikorsky employees. And for the first time in 45 years, there was a strike here. And so you're getting businesses recognizing that it can't bear this burden financially anymore. And so it's got to find an ally someplace to do something different. So I think we're going to find a very different political environment with business, I think, being far more willing to participate in something that would allow them to be able to have health care coverage for their employees as well as themselves in a way that brings down cost and reduces or eliminates their burden of administering and managing a healthcare program that has been now consuming 16% of our gross domestic product. With every indication, if we don't change, it could move to 20 very quickly.